In this exercise video, I'm going to teach you how to do some perineal massaging. This is great for birth prep if you're trying to prepare for a vaginal birth, to help relax the tissues and get used to some stretching in this area. This is also great if you have extra muscle tension in the pelvic floor, which could be causing pelvic pain, back pain, bowel and bladder dysfunction, and all those things. So this is great for those things to help relax the pelvic floor, get some better movement and relaxation through there. So what we're going to do is show you first what just having to use your hands, but you can also use a pelvic wand to help this as well if you're having a hard time reaching or you need a little bit better ergonomics for your wrist and hand. So what we're looking at here is we're going to be using the vaginal opening here. So this is the front side of your body, the front of your pelvis, your pubic bone. This is your sacrum and tailbone and lower back. So we're going to be entering through this opening through the vaginal canal. And really most people need most work in this area here because this is where a lot of tearing tends to happen with childbirth. So we're going to be focusing on areas through here. Occasionally you might need to work more on the front side, but for most people we need to work back in this range. So we're going to be focusing on this back half of the pelvic floor region. So how this looks is, if we look at our model here, this is all the external, how it would look externally. So this is the top of the vulva. This is the bottom of the vulva as we get closer to the rectum. So we use this vaginal opening. What you're going to do if you're doing it by hand is you're going to use your thumbs. So get a little bit of lubrication on your tip of your thumb. Make sure you wash your hands beforehand, then get a little lubrication on your thumb. And you're going to insert just on the inside of that opening here, just to the knuckle of the first knuckle of your thumb. Once you have your thumb hooked in, you're going to start off by pressing down. And for some people, that's enough where we want to just work on doing a little bit of stretching down here. So you may hold for about 30 seconds or whatever's prescribed by your physical therapist. Feel some of that stretching. You might feel some burning, some stinging. That's all normal, but you're going to try to hold and see if it will start to relax and give way. As you're holding, you're working on good belly breathing and relaxation techniques. So you could start off by just going straight down, and if that's uncomfortable, do that for a little while. Then once you feel more comfortable with it, then we're going to start to swoop out to the side. So I'm starting off pressing down and then swooping to the side. Down and swoop. So this is making a little arc to the right. I'm using my right thumb. Down, swoop to the side. We do that for the prescribed amount of repetitions with a little bit of a hold at the end of each swoop. And then we repeat the other way. So now I'm using my left thumb, inserting just to the first knuckle, pressing down, swooping to the left. Pressing down, swooping to the left. Pressing down, swooping to the left. So this is working on each individual side of the pelvic floor to be able to relax. Now, once that's starting to feel comfortable doing each individually, this is where we do both sides at the same time. So now we insert both thumbs to the first knuckle. We press down and then swoop to the side. Down and swoop to the side. Down and swoop. Down and swoop. So that's how to do it by hand with a little lubrication using your thumbs. It is possible to use other fingers if your thumb is sensitive, but it's just a little harder to reach and find the right angle, so thumbs tend to be the easiest for that. If you're going to use a pelvic wand, this is where it can be really nice because you can hold on to one end of the handle and be able to reach the pelvic floor really nicely without having to get into any weird positions or if you have sensitive fingers and thumbs. So what you do is insert this end of the wand. So there's always one end that's a little bit thicker than the other end. You want to use the fatter end. Insert it just to that first bend with lubrication on it, and you want to make sure it's water-based lubrication. Once it's inserted to that first little bit and it's hooked on the back side of the pelvic floor, you're going to come down, and you can again just focus on stretching down first Once that's comfortable, then you can go down and to the side, and then you can make a full U shape going side to side. So I'm going all the way to the left, all the way to the right, and going back and forth in that range. When you're holding onto it from the top end, it tends to look like this. Whoop. Let me get it inserted first. It is easier on yourself, not this jelly model. You hold it here, press down, and you swoop like that. So you can use the wand to help as an extension for that work there. Now, if you find a really tender, tight spot, then you can just hold pressure. So say it's just a little bit off to the right, then you can just hold that pressure here. So you can do kind of a clockwork type of thing, where if you go straight down to 6 o'clock, you can work there. And then 5, 4, 3. And same thing, you can do 6, 7, 8, and 9. So you can do a clockwork as well. So a couple different varieties, whether you want to do the U swoop or you can do the clock pressure that way. No wrong way to do it. So follow directions that were given to you by your physical therapist and try a little bit of both and see what works best for you.